The World Health Organization has said the risk of the spread of the Ebola virus in the Democratic Republic of Congo and in Uganda is high at national and regional level, but globally low. The WHO has expressed concern over the scale and speed of the outbreak, which has led to 139 suspected deaths and almost 600 suspected cases. Worried residents of eastern Congo have reported rising prices for face masks and disinfectants. The Bundibugyo strain of Ebola spreads through direct contact with bodily fluids from infected people or animals. According to the WHO, around 40% of infected patients die. Now, an American doctor who was infected with the Ebola virus while treating patients in the Democratic Republic of Congo has been admitted to Berlin's Charité hospital for special treatment. The patient was flown to Berlin on a medical aircraft and driven to the hospital in a specially designed vehicle. His wife, also a doctor, and children have also been flown to Germany. The German Health Ministry agreed to a US request for the patient to be treated in Berlin due to the shorter travel time from Uganda and the hospital's experience in treating Ebola. And Professor Günther Schönrich is a virologist at Berlin's Charité hospital. He is not directly involved in treating that patient, but he might be able to shed some light on a few questions that we all have. Professor Schönrich, first of all, an Ebola patient has been flown to Germany. Why has he been brought to Berlin, and why is it just him?
Okay, first of all, the Charité is a well-known hospital and belongs to the top 10 hospitals throughout the world, but that is not the main reason. The Charité already has some experience in treating Ebola virus patients. Looking back in 2014, we had 3 patients there. And third reason is that the isolation ward at the Charité University Hospital is associated with an intensive care unit. That means we have all the tools to treat severely ill patients infected with Ebola virus. And a last reason might be that the flight time from the outbreak is much less to Germany than to the United States. That is also, of course, a reason, because that's good for the patient if the flight time is shorter.
But again, I would like to ask, did the Charité have more space for more patients? Because the doctor is so far the only patient who has been brought to Berlin.
Yeah, that is a good question. The capacity is around 20 patients that can be treated on this isolation ward. And yeah, I guess there will be no more than 20 patients after all.
Now, the WHO has declared this outbreak an international emergency. What makes this situation different and more concerning than previous Ebola outbreaks?
The problem here is that the outbreak is caused by a variant. We have altogether 6 Ebola virus variants or strains. Is caused by Bundibugyo virus, Ebola virus, and that is different from recent outbreaks. In recent outbreaks, the Zaire Ebola virus was the culprit. And there's no vaccine against this strain, against the Bundibugyo Ebola virus. That makes life much more difficult. And secondly, rapid testing is also very difficult because the rapid antigen testing is tailored for Zaire Ebola virus.
Now, you say there's no vaccine. When the coronavirus, when that pandemic happened, a vaccine was available very, very quickly. Could the same be done now for that particular strain of Ebola virus?
There are indeed some candidates, vaccine candidates that are very interesting, but it will be difficult, very difficult to produce the amount needed. And I guess we will continue with not having a vaccine against Bundibugyo Ebola virus, unfortunately. And that is in part also due to the fact that there is no major interest from the industry to produce such a vaccine because, it's very expensive.
Mm-hmm. Now, is an Ebola infection a death sentence, or can it be treated?
It can be treated, especially an infection with Bundibugyo virus, and this is the good news, is less lethal. So the case fatality rate is about 30-40% in comparison to Zaire Ebola virus, where you encounter a case fatality rate of 90%. Mm-hmm. And under condition of intensive care unit, you can lower the case fatality rate to maybe 10%, 20%. Mm-hmm. So the situation in this regard is much better than in previous outbreaks.
Now, how does it spread? Is it easy to catch?
I would say no. It's, of course, not comparable to SARS-CoV-2. That means the culprit that caused the COVID-19 pandemic, because it's not passed on from one person to another person via aerosols or droplets. You have to get in close contact with infected people. So you have to touch, in fact, body fluids like blood or semen, indeed. And therefore, close contact is very, very important to get infected.
And finally, for our viewers at home, many are worried, of course. If you would be living, and you do live in Berlin, what should people realistically worry about, and what shouldn't they worry about when they hear Ebola in Berlin?
Of course, everybody is impressed by Ebola virus because we know this type of virus from movies. But I think the risk here in Europe, in Berlin, is very, very, very low. We might see maybe a few cases, but they will be isolated very fast. And therefore, I don't think there will be spread beyond the borders of the region that we look at the moment. And that is not at least due to the fact that only patients that have already symptoms are contagious. That means they can infect other persons. And that is the reason why you can immediately isolate suspected persons and therefore stop the virus spread. So
Berliners shouldn't be worried because an Ebola patient is being treated at the Charité?
No. Yes, it's no risk, no risk at all. I mean, you have seen how the patient was transported from the airport to the clinic, and there's everything you can think of is done to prevent any risk. Therefore, Berlin shouldn't be in fear, not at all.
And that was Professor Günther Schönrich from Berlin's Charité Hospital, a virologist. Thank you very much.
You're welcome.